Today is Thursday, November 20th. Today's Thursday, February 26th, 2026. So I started for the last couple of months, I've been experimenting. I've been using an app called NutriSense with a blood sugar sensor that is called Stella. So I'm going to do it, kind of start to do a deep dive into how blood sugar trends using these apps with NutriSense and Stella working together, and how a person can visualize and impact their own health. Okay, let's understand the technology. The technology of this app is designed to help users visualize and understand their blood sugar patterns by providing real-time data from the Stella sensor, which continuously measures your glucose levels, allowing for detailed tracking, analysis of how your diet and exercise and lifestyle is affecting your blood sugar. I'm going to do a couple of deep dives. Number one, I plan to review on the next couple of videos, I'm planning on reviewing my historical data on this NutriSense app. I'm going to be focusing on trends before and after the noticeable drop. Key factors to consider include changes in your meal composition, physical activity, stress level, sleep pattern. Comparing these variables may reveal a correlation or triggers. And this is going to be the next couple of steps. I plan on visualizing my glucose data for the next couple of weeks. I will identify some of my dietary and lifestyle changes that I've been making that will coincide with the drop. And I always recommend to consult with a healthcare provider to interpret the data and ensure the drop is healthy. Let's talk about continuing to monitor and see if they persist or stabilizes. You have to understand what your blood sugar there is, because basically you are what you eat. And if you can constantly eat things like soda, or things with high fructose corn syrup, or carbs or sugars, that's going to spike your blood sugar. And these apps give you a wonderful way to get that under control. Especially controlling your blood sugar. So you have to have a certain amount of protein. A certain amount of carbs is great. And you have to have a high fiber. Quality fats are good too. But once again, a lot of these obesity epidemics started happening when we had modern industrial processed foods started coming about. The obesity epidemic originally came about was in the 1900s. 1916 was when it started really taking off. I don't know if you guys know anything about history. If you remember the FDA, where the FDA originally got started at Indiana State University, and the suicide squads. The suicide squads would receive a specific type of meal every day by the instructor, because he was trying to determine why his students were getting sick and why some of them were dying. So in other words, you have to know about your food that you're eating, but the ingredients, what's in it. So last week I was just doing some research, and I went into Albertsons, and I was looking at a thing of Barilla spaghetti, and that had so many words that you could just literally wrap the entire building around it. Whereas if you were to go and grab proper spaghetti, it would have egg, flour, water, maybe salt. And we go 40fitclub.fit. My name is Steven. Have a wonderful night.